So surgery day typically, usually required to get there an hour and a half to 2 hours beforehand, and the main reason for that is just preparation for surgery. Talk with the nursing staff and anesthesia staff, placement of an IV, and then I think more pertinent is typically the pain management process surrounding a surgical procedure, and typically it requires, the procedure itself is under a general anesthetic, so the patient is asleep for it, but the anesthesiologist will talk to them the day of about an interscalene nerve block. It's a medication that's done under ultrasound, typically around the nerve plexus, the interscalene region in the shoulder, that provides excellent pain relief for 12 to 18 hours or longer following the operation. So that is a major part of sort of pain management and pain control around a replacement surgery.